Two, one. Well, hello out there in SADS Facebook Live land. I'm Mike Ackerman. Welcome. Good afternoon, good evening, or good morning, depending on where you are across the globe. I'm a genetic cardiologist at Mayo Clinic and the director of Mayo Clinic's Winland Smith Rice Genetic Heart Rhythm Clinic and Sudden Death Genomics Laboratory. And it's great to be back with you on this Friday. It's our 31st episode, everyone. And so on behalf of Alice Laura, the CEO of the Sudden Arrhythmia Death Syndrome Foundation, the SADS Foundation, we're glad that you've chosen to join us. And I'm really glad to be joined today by two really great people, good friends, real colleagues, and very important in our world of pediatric heart rhythm disorders and the Pediatric and Adult Congenital EP Society. They are on my that way, Dr. Aarti Dalal from Washington University and St. Louis Children's Hospital. And on the other way, Dr. Pete Aziz from Cleveland Clinic. So Aarti and Pete, thanks a lot for joining us today.
Thanks for having us.
So here we are, the last Friday of September, and as we all know, we've crossed some unfortunate milestones in the COVID-19 pandemic, where this week in the United States, we crossed 200,000 COVID-19 associated deaths. We're going to soon eclipse the 7 million mark for cases in the United States, 32 million worldwide, and we're approaching the 1 million death mark in the world, 983,000 plus cases. The death rate, good news, right? It's really low overall. In our county, if you come to Mayo Clinic with COVID-19, the death rate is under 1%. So keep that in mind. But I would say bad news, we're getting sloppy out there. The social gathering violations and things are happening. We're seeing an uptick in Minnesota, in Wisconsin, in North Dakota. We're sort of seeing it creep up even among employees of the various hospital institutions, not from the hospital. The hospital is an incredibly safe place to be, and the outpatient centers are incredibly safe. Here at Mayo, at Cleveland Clinic, at St. Louis Children's, it's what we all are doing off hours, after hours, nights and weekends, and social gatherings. So I reminded my research team today, I'll remind you all, be careful. Put the mask on, wear it, stay 6 feet away, wash your hands a lot, don't touch your eyes and your mouth. These things work, and just be careful with what you're doing. We can do this. Now, back to the topic at hand, or the what we can do together. This Friday today wraps up the back to school month for the SADS Foundation and SADS Safe Schools. How do we help our families with SADS conditions, genetic heart conditions, whichever you come with? How do you do the school thing, and how are you doing the school thing? We're about a month in, hybrid, home only, on campus live. We're a month in with some of you going back to sports on campus in a variety of ways. And so to talk about these issues, it's great having Aarti on my right, your left, or whatever camera stage we're in, and Pete to chat about it. So, Aarti, before I ask the questions that you're getting asked, let our SADS Facebook Live community in on a little bit of who is this Dr. Aarti Dalal anyway.
Sure. So one, I just want to say thank you for having me. I'm really excited. These are some amazing sessions, and I'm glad I get to be part of it. So as mentioned, my name is Aarti Dalal. I am an electrophysiologist here at St. Louis Children's in St. Louis, Missouri. I am not originally from the Midwest, so this is sort of a new area for me. I moved here from the East Coast, which is where my family is from. But it's been one of the things that I've really loved is working with this patient population. With my Dr. Ackerman, I've had the opportunity to sort of get really involved in SADS and sort of help participate in the care for the patient population that we're speaking about today. So it's been great for me, sort of working and collaborating with this community, and I've learned so much and got really close to Alice and her team. So it's been quite enjoyable for me. So I wanted to thank you for having me.
Well, Dr. Dalal, it's great having you, and I'm looking forward to having our conversation. And just for all three of us, we'll lay the ground rules so that none of us run the risk of, I called Pete Dr. Aziz, and I might have called Dr. Law Arti, and then, hey, what's up? Why did you call one person with 2 X chromosomes? You know, we're not going to worry about all of that. We are going to be first name, Mike, Pete, Arti. So, Dr. Pete Aziz. Pete, tell us a little bit about who you are and how you ended up from where you ended up back to Ohio.
Well, I'm glad we're in a safe place. That's the most important thing about this, Mike. But thanks to SADS, and thanks, Mike, for the generous offer to be part of this extraordinary effort. So we appreciate it. So I actually was born and raised in Cleveland. I live a mile away from the house I grew up in. My father was a physician and was a Cleveland Clinic employee. So I followed in his footsteps in a lot of ways, though left when I was 18 and went off to do training and came back when I was done. Never did I think I'd be living in Cleveland for the rest of my life when I was 18, but it's a great place to have a family and to raise children and to be by my parents too. So it's worked out in a lot of ways. So along the same vein, in terms of the mission of SADS and what we're talking about today, I have 3 daughters, and my wife and I have had several conversations and still do about what the right thing to do with our own children is. None of them have SADS conditions, though we can easily implement that into the conversation. I could see that and how everybody on the call struggles with it too, because we struggle with it with our own children, and so many factors at play, and different environments, different schools. I think it's hard to make blanket statements, and it's really useful to have conversations like this to try to dissect all the variables that are out there.
Great. Well, Arti and I, we are starting to develop a lot of special memories together, but Pete and I, we have more. I've known Pete longer, and I still can take myself back to the time when LeBron James and the Cleveland Cavaliers won it all in the NBA, and was watching one of the games with Pete. And so special times. These are 2 very special people to me in our field, and I count them as real friends. So Arti,
one of the first text messages that I got after the Cap won in 2016 was from you, saying congratulations. That was a special moment for me for so many reasons. To get a text from you made it special too.
Yeah, that was a special time, and we are in real time now, aren't we? And Arti, I'm just curious, with this whole back to school time that we've been in for your practice the last 6 to 8 weeks, as the kids and our families have called in with questions, what's been sort of the number one recurring call over and over? And I guess this is the old phone, right? I should use the phone. As to what are your families with pediatric heart rhythm conditions in general, or genetic channelopathies in particular? What's been the over and over again question that's been posed to you and your team?
Yeah, I mean, I think the biggest question is it safe to go back to school, right? And what is the right decision? I think everybody wants to make sure that they're doing the right thing for their family and for their children. And so the question that's posed to me and my team often is, well, one, what would you do? Or what should I do? And is it safe to go back to school? And I think you sort of hinted at this, which is it's quickly changing, right? And we have to make sure that all of us are sort of abiding by proper behavior, which is hand washing and wearing masks. But how you choose to send your child back to school truly is an individual decision, right? And it's based on what is the percentage of infection in your community, and what are the things that your school has the ability to put in place. There are schools that are smaller just because of where they're located, and therefore they have the ability to sort of isolate a little bit more. So I think there is no right answer, right? But I think this is why we're having this conversation. So I'd love to sort of hear from participants today and sort of see what they're doing and what they've done. But I think that is the biggest question. Can they go back to school? And is it okay to go back to school?
And don't you think, Arti and Pete, that's in part not because we're afraid that they're at risk, because they have a spooky heart disease that's now going to blow up with COVID-19. I mean, I can count still on one hand, I think I've now used all 5 fingers of the 3,000 channelopathy patients here who we know have come down with COVID-19. And of that one hand, all have been basically nothing diseases. So I'm not worried that our patients are set up for a bad COVID-19 outcome.
Right.
But I still want them, like I still want my daughter and my 3 boys and my granddaughter to stay corona-free for as long as possible.
Exactly. Exactly right.
And,
yeah. So I agree. So I think there's no indication that our patients are at higher risk, right, because of their diagnosis. But it's because we want, just as I want you and me and Pete to stay healthy, we want all of our patients to stay healthy. And if we have ways to prevent it, then that's what we want to recommend. Again, not going to school is not the answer, right? That's not the prevention, but it's how do you stay safe? And so I don't want people to think by going back to school, they're putting themselves at higher risk, or their child is going to get it faster than someone else or get sicker. Exactly.
Yeah. Pete, how about you in Cleveland? What's sort of been the big question that's been top of mind for your families that have been calling up? And then I'm going to turn to how you and your wife decided to do what you're currently doing with your 3 girls.
Yeah. So by far and away, the most common question that we've got, and I think it mimics a lot of what the CDC is trying to do in terms of education, again, well-intending, but can be misinterpreted based on your frame of reference, was the notion of having cardiovascular disease is a risk factor for a bad outcome with COVID. And what we try to clarify when we're asked that question is the cardiovascular disease that the CDC is referring to is the generic cardiovascular disease that exists in the adult population that is acquired, coronary disease, heart attacks, things of that nature, which fortunately our children typically don't have, and our patients with SADS conditions are removed from. The inherited arrhythmia piece, the long QT, the CPVT, the Brugada, that makes the majority of our channelopathy patients, isn't really part of that cardiac disease diagnosis. So I think that's a nice piece of education there for our families. Is they don't really mean you guys. It really is the other people with cardiovascular disease that we get more worried about. And then we fall back on, I think, as the corollary of that conversation, well, what is the risk? And Mike and Aarti, you've touched on this already. We fall back on what we know. So there's a lot of enigma in COVID and in the pediatric patients, and even to some degree with the inherited channelopathy patients. So I think by every signal so far, it seems that things are favorable. I would say that we still fall back on the pillars of what we teach our families, avoiding medications that we should be avoiding in long QT syndrome anyway. So when it comes to the hydroxychloroquine and the Z-Pak conversation, and I think it makes 3 of us cringe when we hear that in the context of long QT syndrome. We have to be very disciplined about whether that makes sense for our patient population. Going along the same vein, the whole fever topic, right, with our Brugada patients. I'm more worried not necessarily that you were to contract COVID, but what does a fever for 7 days mean if you have Brugada syndrome as an underlying channelopathy, and how we can circumvent that risk by treating the fevers aggressively, like we would normally do with any viral condition.
Right.
Otherwise.
Right. And I think I like what you said, Pete, about helping our families realize that, yes, they have heart disease, but no, this is not the heart disease that everybody talked about in February when they freaked out all of our families. And that's as many of the SADS Facebook Live, and Dana from Ireland, who's joined us, and hi Dana, and the others know. That's why we launched SADS Facebook Live for the first time in March, is some of you started calling and saying, I just saw the paper that if you have heart disease, I'm going to do bad with COVID. And is long QT heart disease? And we had to remind each other, yes, it's heart disease. It's not the heart disease that matters. So I tell all of our families that, look, you 19-year-old you 17-year-old with CPVT, long QT, your risk of COVID-19 is exactly the same as my 17-year-old daughter. You 54-year-old who's healthy, looks like me, healthy, your risk is exactly the same as mine if you are otherwise healthy. But we've also said, and I think it's been a good opportunity, if you are obese and you have a channelopathy, it's time to get that scale heading into a different direction, because over and over and over again, the risk factor that's coming out for doing poorly with COVID-19 is obesity, smoking, high blood pressure, and being old. And you can't change the age, but we still can change the other things. So being active, losing weight, it's a great time to do that. Aarti, before I ask Pete about his 3 girls and what he and his wife have done, what's another top of mind question that's been posed to you in the last 6 weeks as they've called you about the school return scenario? Any specific particular item that they're wanting clarification on?
Yeah, I mean, I think the biggest thing is so if they go back to school, right? So details of what they're allowed to do, or what kind of interaction they can have. And so I think a lot of it is things like, gym class, or if they are engaged in organized sports, what can they participate in those types of things? And so where I live in St. Louis, we have fairly strict guidelines right now by the city and the county about what sports are allowed to sort of resume and which ones we're sort of deferring for the season. But I think again, we know that it's sort of, I think you have to, like all of these things, sort of understand what's happening in your community. So I think that it becomes a very individual conversation, right, with your provider, but also with each of you, right? So I know there's like Brianne and Dana is on the line, and Victoria. So I think it's important that we have those conversations individually with your families and sort of say, what is your school doing? Let's understand that risk. But so those are often the questions, because, right, I think Pete and Mike would agree that our patients engage in activities as well. And so one of the big questions is, once I'm going back, how normal can it be? Is it I go to school and I come back, or am I allowed to do things that I would normally do if the school is allowing it? And so again, it goes back to understanding all of those risks that you just highlighted.
Yeah, and Aarti, a great question that's been posed to us, and maybe you could take it as well, is if I'm part of a family with long QT syndrome, say, and I have a 16-year-old with it or without it, frankly, a 10-year-old with it or without it, frankly, am my concern meter set differently for the 16-year-old than the 10-year-old? I mean, do you think it's safer or less safe for our adolescent high school population than it is for our elementary population? And I know the answer is it depends. It's complicated, but what would you say in general for them? Do you think differently?
Is this going back to activity or going back to school?
Just the back to school thing. Are you more anxious about a 16-year-old returning to school than a 10-year-old, for example, if in the same setting you were pleased as a parent with sort of the logistics that are set up and so forth?
So I will tell you, I would not be. It's interesting, right? If you actually look at the way schools are doing the return to school, and I'll speak specifically for St. Louis and sort of the area that I live in, is because we were looking at the way who was getting sicker, and again, the transmission, we let our younger kids go back to school in person sooner than we did our older kids. But again, I think the same thing that's happening right now in our communities was happening then, which is it's what kids are doing outside or afterwards, right? So I guess my short answer is no. I would not be more concerned about your 16-year-old versus your 10-year-old. But it's also important to remember, when your 16-year-old goes back to school, they're going to be so excited to see their friends, as younger children are, but they have the opportunity and a little bit more independence, right, to go and say, well, let's sort of meet up after school and sort of hang out a little bit without our masks, without social distancing. So I think it's those things. It's important to sort of make sure that communication, just like Pete was saying, right, we have to engage in the conversation about making safe choices. That includes making sure that we're staying active and losing weight if we are overweight, right? But also making sure that we're being cognizant about, if I'm going to go to school, wash your hands as soon as you get home, and wear your mask and all of those things. But so long answer to your question, which is I would not be more concerned about the 10 versus 16-year-old.
Yeah, and I know when we started the back to school thing in the first of the month, my wife and I were totally ready to send our 17-year-old daughter back for her senior year. And then a week later, the school system declared it remote only for our high school, which she's doing and she loves. Our 20-year-old son is at Baylor University, and we were very comfortable with sending him back because we were pleased with what that university had set up, and a month into it, we're really pleased. I mean, that's a university that people want to look at on their website, for example, as to what they're doing to keep the students, faculty, school. There's certain universities that are doing it right and doing it well, and I'm glad my son's at one of them. And he called me the other day and said, Dad, I think I'm way safer here right now than I am back in your neck of the wood. I'm not sure about that, but I'm glad he's confident. But Pete, those same things you and your wife wrestled with, I know, with your 3 daughters, different ages, but what conclusions did you make as a mom and a dad, sizing up your satisfaction with what their school system was doing or wasn't doing?
Yeah, so the first thing I'll admit here is that we keep having this conversation because not only do the metrics change a little bit, the environment changes a little bit. I think it's just simply a hard question to answer. I think it's hard for us to wrap our minds around it entirely. But that being said, I think the factors that play into it, in my mind, are relatively simple. So if we can make parallels here, the way I think about anything that's organized, whether it's school or any situation where they're prepared to have a large number of children at, the forethought that goes into it, and our school district is the same. They are intending, of course, to keep our children safe. So the idea behind having kids in school isn't let's get the kids school because they need to be there. It's how do we make this the safest environment as they can? And everybody is thinking about it the right way, from the principals to the teachers to the janitors. It's hard to get everybody on the same page and focused on something that well. So I put a lot of trust into that system. I think the parallel that I was mentioning before is with our long QT patients and sports participation. I'd much rather have a long QT patient play in an organized sport where there's lots of people around, where conversations are being made, where preparations are thought of months in advance, than my child just playing pickup basketball in a park with nobody around. And I would say the parallel here, organized sports are like school, and then everything that's extracurricular that you do is kind of like the social event gatherings that you do, where, you know, a lot of the regulations that we all have in place for things like school disappear. Mask, distancing, all the things that Mike had mentioned before, maybe aren't being as paid close attention to as they should be.
Yeah, and it's interesting you said that, Pete, and I'm going to ask you a question from Victoria, who's one of our Facebook Live regulars, and I've appreciated her greatly. And let's go right into this one. She's asking, Pete, for organized sports like soccer, lacrosse, on the field, what if they refuse to wear masks as coaches and teams? Do we still participate in high school, after-school sports with long QT? I suppose maybe it's sort of, what do we do if, as a family, we're not pleased or satisfied, whether you have long QT or don't have long QT? Because again, I don't really care for the long QT sister and the normal negative brother. To me, both on the lacrosse team, I think of it exactly the same way, But what do we do then if you then say, wow, I'm not really happy with what the school is doing or what our conference is doing for how they're respecting this virus or not respecting the virus?
That's
Victoria?
Great question, Victoria. I think you're getting to the crux of the matter here, is that, in my opinion, there's a social contract for us being able to get back to, you know, life is normal, or the new normal. And that simply is, if we understand the science behind it, and there are very clear guidelines in terms of how we prevent infection and spread, that, in my opinion, is the very least that we can do. So if we all want to play soccer and football and lacrosse, I have no problem with it, as long as we are sort of drinking the same Kool-Aid and saying, if that's the rule, then that's the rule. If you want to play, then this is what you got to do. And I think that's a hard line for me. I think if people aren't participating in that same way, not only is it unfair, but you're really putting people's lives potentially at risk. Not so much the kids that are participating, but as we all know, what goes on at home after, who gets exposed. once junior picks it up at the lacrosse game, which is probably more of the concern. So I think you're totally within right to bring this up to the school board, bring this up to the athletic director, and say there's got to be consistency here. There's got to be adjudication in black and white in that way.
And I think, Pete and Aarti, like you said, it's not really Junior getting it. He's going to do fine if he gets it. His risk, long QT or not long QT, he's going to clear this virus 99% success. It's Junior bringing it home and saying hi and hugging Grandma and Grandpa who are 80 and frail. And then we go to Grandma and Grandpa's funeral. There's an interesting paper that came out that said, all things considered, if you're otherwise healthy and you are 85 plus and you get COVID-19, you have a 1 in 7 chance of dying. Whereas if you are 35 and younger and you get SARS-CoV-2, it's like a 1 in 1,500 chance. So incredibly low. And so it's really, like you said, the whole social thing, not out of fear for my Johnny or Sally getting it, but what's going to be the ripple effect. And I think Sherry just shared with her in-laws, her husband with LQT3 going to a memorial. Why is she at a memorial? There was 49 and overweight. Now, that is the setup for why that cousin died at a younger age at 49. But the concern that I have is the memorial, is who else has it there. So our son was just one of the groomsmen in a wedding this last weekend. So social gathering. He calls me up today just about a half hour ago, Dad, I'm not feeling very well. I said, oh, great. He said, now how's your smell? Because I think the smell test is the best thing is this it? But it's all of those things that we're choosing to do when we get going back in life again that we're not thinking about carefully and saying, okay, I left that gathering where I don't know the state of everybody's safety measures. Did I come home and wash myself up really, really good? And so it's sort of thinking through it. And Aarti, any examples like that you have that you want to remind everybody of as well?
Well, I mean, I think there's been multiple, right? I think we've seen this across the country after like every 3-day holiday, like weekend, right? We saw it. But I think there's an excitement, right? People are going back to school. They get to see their friends. All of us are fatigued, right? I mean, I know I personally am fatigued just of COVID, but I think it's happening where we'll have, people getting together, whether it's after work or, from school, and you'll hear about spikes. Again, I've been trying to be very thoughtful about making those choices. I would love to see all of my friends, but I also realize it's important to be thoughtful and protecting each other, right? It's not just about protecting me, but the people that I encounter every day. I want to make sure I'm doing my job as a good citizen of taking care of the people around me. So, I mean, there are multiple sort of stories like that around in my sort of, circle, but right. I think we all just have to make the decisions, like Pete said, right? We know things that work. And so we just have to all commit to follow those recommendations and then decide, right? I mean, I think, being part of a wedding is important. We can't forget to engage in the life events that happen throughout COVID, right? We don't stop having birthdays. We don't stop having reasons to celebrate, and those things are going to happen. But how you choose to do them. So understand what that risk is. Are you then going to go to grandma's house if you potentially exposed yourself, right, to people that you may not know if they've been as good as you about hand washing and mask wearing and being thoughtful, right? So I think, again, I think those are really the conversations about making sure you're aware of what your social circle is doing and then who you're potentially putting at risk if someone does get COVID.
Yeah, and I love what you're thinking there, and I love Kim's comment. Kim on Facebook Live, quick text us where you're from. You're revealing yourself with rugby as the sport for your family, but I love her question because she as a mom is impressed with everything that the organization has assembled, and I think that's why what every family needs to do is, are you pleased with the logistics set up and the infrastructure set up? And are you satisfied with it? Are they taking it seriously? Are they respecting the virus? Remember, hashtag refuse to fear, but are they respecting it? And are they giving it the respect that it deserves, not just for Johnny and Sally, but for Johnny and Sally's 80-year-old grandfather, grandmother that they might meet? And those places that are doing it well, that's great. Those places where you're dissatisfied, you be the game changer, and you give them the wake-up call as to what you need for them to happen. Here's a disease-specific one. I like this one from Christine. And I'm curious for Aarti and Pete what you would tell them, and then I'll tell you what I might do. She's 13-year-old, her daughter. She's one of the channelopathies of CPVT, which we talked about out there, taken care of by a pediatric cardiologist in South Carolina. Even saw yours truly virtually, so it sort of counts, the whole video medicine. She's on CPVT therapy with Nadolol and flecainide, and her daughter just came home from school being told by the gym teacher that they're going to be doing timed physical tests in gym class. Maybe that's, running the drills on the basketball court, whatever it is. And mom doesn't like it. Mom's saying, I don't think it's appropriate for her to participate. Pete, what say you? Do you agree with mom? Yes or no? And then Aarti, and then me.
Well, I think, Christine, we're halfway there. I think your level of discomfort with this is very telling. And I think in order for us to get to a place where we think that this is a reasonable thing to do, Christine, you'd have to be on board with it, I think, first and foremost. So I think it probably starts there. It starts with the family. We've had these conversations, Mike and Aarti, I know you've had them too. And if we blinded ourselves to who this patient was and looked at it objectively, I don't think we're doing ourselves a favor. So in other words, if you just said 13-year-old CPVT on flecainide and Nadolol, that tells me a good amount about their disease substrate. One is that you have CPVT. Two is that you likely failed Nadolol monotherapy and you had some breakthrough, whether it was symptomatic or with stress testing, that you required to be on flecainide. So the degree of, on the spectrum of severity here is probably moderate rather than weak. And that's not uncommon for a CPVT patient, but there is risk here clearly. In order, Christine, for you to be comfortable with it, I think we in the school would have to prove to you that the environment that surrounds your daughter participating is safe too. And clearly we're not there yet. So that would, I think, take some work. The other thought of it is that really something that you'd want? And is that something that your daughter would want? If your daughter's not interested in doing time tests, that's one thing, but you probably have to explore this from many different perspectives. In particular, would restricting her from doing that have unintended consequences? And that's a little bit harder thing to adjudicate and something that you need your daughter's input in. But at any rate, I think all of those factors are part and parcel in the decision-making process and do require a very lengthy and thoughtful discussion, I think. So it's a little bit difficult to answer empirically. Rather, we have to dissect and get into the weeds a little bit of who you are, your daughter is, what the school's like. Those parts of the piece really matter.
I love how you've unpacked the elements that are necessary to discuss. So Aarti, what would you tell Christine?
Yeah, great questions, Christine. So I think I actually agree with Pete. So which is, it's hard to say, it's not, it often isn't, right, with our patient population, an easy and black and white yes or no. It's really understanding that individual patient. So for me, Christine, I have to understand, again, like Pete said, how bad is your daughter's disease? Because we know that there are patients with CPVT that we don't let participate in timed sports or any varsity level athletics, but others that actually have a milder case, and if they're well controlled on antiarrhythmic therapy, actually do have the ability to do sort of higher level activity. Based on how she's doing at her last visit, I think it's a conversation. But I think, like Pete said, it's not a decision. Hi, I'm a coach. I want your daughter to do this. It's, hi, I'm a coach. Before we even engage in these types of activities with your child, we need to make sure that there's an emergency action plan in place. What is the conversation you've actually had with your family? I need to know where your child's diagnosis is. I need to know, and you have to be part of the conversation, right? Christine, you and your daughter have to be part of that conversation with input from your medical care provider to make sure that the four of you have come to a decision that you all agree with. So it's never unilateral. And it's important that there is buy-in from all members involved, because as Pete and Mike know, we need to make sure that your daughter's safety is priority. And I think that is the thing that you're sort of hinting at. You don't want her to participate because it sounds like maybe your school doesn't have that, you've not had that conversation, and that level of safety may not have been established yet.
Great. Well, I invited you two to be on the show, and I completely disagree. No, I'm kidding out there. I just thought I would try that, see what that did. So, did Aarti and Pete do great with that? I think your daughter should be made to do it by the drill sergeant's gym teacher. And if he or she, the drill sergeant, isn't satisfied with the time, make her do it again and again and again. No, not at all. But what I would say is, if we, as your daughter's CPVT specialist, were pleased with the treatment program, and we're pleased with the level of protection afforded by that treatment program, in this case, combination therapy with nadolol and flecainide, and I'm pleased, and Pete's pleased, and Aarti's pleased, then you can almost do anything you want, whether that gym class is volleyball or something timed tests. So I'm not going to set up a differential risk to say that gym class activity is good, this one no, that one yes, this one no. It's really more of, I like your daughter's treatment program. I'm as confident as I can be in its therapeutic efficacy. Now it's in your court. What makes you feel comfortable? And Pete, Aarti, and I have learned early on in our careers that, number one, moms are almost always right. So, Mom, Christine, if you don't like this, you have a gut feeling, I don't really care whether your gut feeling is factually accurate or completely, paranoid. If that's the maternal instinct, you always honor that. You always act on it. And she doesn't need to do that timed activity. You didn't need our permission to say, is this gym class an okay one? Because in my view, if I'm pleased with your treatment program, almost every gym class activity is acceptable. Now, if you're not pleased with that said activity, then, your daughter says, I don't want to do this time thing. I'll be the first person to write your daughter an exception clause to get out of that activity. And so I think it's not always the case where we are 3 for 3 on the same page. Before I answer a question that has come up, I guess, as an urgent question, and it's making its way through long QT social media circuits, and I'll clarify and correct some of the mythology out there with Barbara's really important question. Before I do that, Pete, I'm going to give you your last word as to what you would want to leave our SADS families with as we wrap up September. And then Aarti, you the same. I'll give you the final word. And then I'll take try to clarify some of the misconceptions around this final question. Dr. Pete Aziz, your final word.
So I think we've hit on some key concepts here. One is we really, as a medical community that deal with SADS conditions, feel that the risk in our SADS population is pretty parallel to the risk of patients without SADS conditions at the same age. And it's so important to hammer that point in, because there can be some confusion in interpreting what messaging we're getting from others. So I'm really glad we touched on that. I think the other point that I found really enjoyable to sort of watch and partake in is everybody, of course, feels about this, just like everything in medicine. People have their own preconceived notions and feel very differently about whether it's okay for their child to go to school or not. And a lot of what is important in that conversation may or may not be objective, and we just have to be okay with that. That is people's personal decision, and we're here to support that. We're here to support you as patients, as family members, and And I think that part of it's a lot of fun, actually. I think that's what makes this job so enjoyable.
Thanks, Pete. And Dr. Aarti Dalal.
I guess what I would say is, remember, as parents truly are your child's best advocate. And I think it goes back to Christine's sort of question, which is, in general, don't let anyone ever bully you into feeling like you can't send your kid to school or you should send your kid to school, right? It's ultimately what you want to do. But the important thing to remember really is that, yes, your child is going to be safe based on, right, what you, your community, and your school have put into place to protect your child and every child. But what you decide to do for your family is the right decision for you and your family. So if there are questions about your specific child, about, is it based on what we know is in your community, talk to your physician, right? Talk to your healthcare provider. But again, what I would say is you ultimately will make the right decision for your family, and don't ever let someone else tell you that you need to do X or Y. But I think the SADS community is a really strong advocacy community and a great education community. So reach out, ask us. We're all available to all of you, regardless of where you are. So we're happy to answer all of your questions. But let's keep working together to take care of each other.
That's great. And I'm really grateful for you two joining us. And I did promise Barbara, because this question has been brought to SAD's attention, to address her question. And Barbara, the question that's come out, Pete and Aarti out there, is about the virus. So SARS-CoV-2 and COVID-19 having the ability to lengthen the QT interval as a sequelae of the viral infection into the heart muscle. And then why is that not dangerous if I already have long QT syndrome? And then if that's not acquired long QT syndrome, then what is? So there's a lot to unpack there, because I think a lot of anxiety has surfaced in the last week or two about this. So first, start with fact. Fact, the SARS-CoV-2 virus can infect the heart muscle. Fact, when it infects the heart muscle, it can prolong the action potential duration of the cardiac cell. Translation, in humans with COVID-19, if you look at their ECGs are slightly longer than in humans without the virus. So there is, independent of the hydroxychloroquine thing that Pete brought up, the ability of the virus to nudge the QT interval longer, not make it spooky long by itself, nudge it longer. That was one of the reasons why we came out very early in March saying that, yes, hydroxychloroquine, been around forever, is an incredibly safe drug if you have malaria and you're being treated to prevent that, or if you have lupus. But it's a completely different story if you have this virus, because at that time we didn't know exactly what does the virus do to the heart muscle itself. Lupus doesn't do anything to the heart muscle itself. So it was a dangerous combination of hydroxychloroquine in the setting of this viral illness, and then you add long QT on top of that. If you had long QT, hydroxychloroquine could be deadly. And we had said early on that none of our long QT patients will ever get put on hydroxychloroquine or azithromycin without my permission, or in Aarti's case, without her permission, Pete's case, without his explicit permission. And the good news is almost none of our long QT patients are getting the virus. So, and those who are getting the virus are having a nothing result, meaning, Barbara, that even if this is true, what we've discovered at the bench, that this virus can lengthen the cellular action potential, which translates into lengthening the QT a little, that on top of long QT genetic isn't enough to cause a problem, unlike long QT patient going into the emergency room because of nausea and being put on a truckload of Zofran and then wondering why they're having acquired long QT syndrome. So these are true statements, but this sort of scientific nugget of what this virus can do on its own to the cardiac cells electrical system, and therefore in the QT interval, is a really, really, really weak signal. And so it's not acquired long QT syndrome by itself. It is viral mediated QT lengthening, which is of a modest, small degree that obviously isn't looking like it matters, because worldwide, we're not seeing any signal of a 1-2 punch of people with genetic long QT getting COVID-19 and then their heart's going crazy on them. So not happening out there. So it's one of those scientifically true observations that clinically doesn't matter that much. I hope that helped put out whatever social media, SADS community anxiety has crept in with that piece of information. So that brings us to the end. We're going to be really excited next week. Join us. I'll be joined next week by Dr. Sammy Biskin, one of the scientific advisory board members for a long time now for the SADS Foundation. And he is going to review with me what he thinks have been some of the most important discoveries of 2020 as it relates to our genetic heart condition. So until then, stay well, stay corona-free, refuse to fear, and join us again for the first Friday of October. And so, Aarti, thank you. Pete, thank you. And you and your families, be well. And I look forward to having you guys back in the future if you'll join me again.
I would love it. It would be great.
All right. Take care, everyone.
You guys have a good afternoon. Bye-bye.